Mr. Advani, thank you so much for your time. And with regards to rhinoplasty, then, it's often labeled as both medical and cosmetic. But can you break that down? Where is the line drawn? And how motivations differ between patients for various different reasons?
Yeah, thank you very much for having me on this podcast, Connor. And that's a really good question. So, in my opinion, the line between medical and cosmetic rhinoplasty comes down to function. And by function, I mean the ability for the nose to breathe. Um, Medical rhinoplasty is done to improve nasal breathing. And this can be things such as fixing a deviated nasal septum, which is the middle part of your nose, or fixing collapsed nasal valves, which is sort of the outside part of your nose. When you breathe, it should not collapse inwards. Whereas cosmetic rhinoplasty focuses purely on appearance and facial balance. Now, in my experience, most patients actually sit somewhere in between. They want a good nasal airflow, so good function of their nose. And in addition to this, they want a more refined look. And needless to say, if you have a really bent nose, which is obstructing the function of your nose, the only real way to improve the function is to also improve the appearance and straightening out the nose. So function and aesthetics, or cosmetic and medical rhinoplasty, goes hand in hand. Um, I found that patients' motivations are slightly different. Functional patients tend to talk more about nasal blockage, snoring, mouth breathing, whereas cosmetic patients talk and focus more on improving their confidence and the proportions of things on their face that are just not fitting right.
Fantastic, Mr. Advani. Leading us nicely then to question number two. How much of rhinoplasty is science and how much is actually art or cosmetic?
Yeah, once again, a very interesting question. I don't think you can separate the two. I think in rhinoplasty, in my opinion, it's both an art and a science. The science is understanding the anatomy of the nose, preserving the support of the nose, and ensuring the nose functions well. So it should do its primary job, which is allowing air to enter your nose, humidifying the air, and helping you breathe. Um, so that's sort of the science of rhinoplasty. The art of rhinoplasty is judging proportions, judging angles, seeing how the nose harmonizes and fits into someone's unique features of the face. Creating the right nose isn't, in my opinion, about copying a shape. It's about reducing, or it's about matching the patient's nose to their unique facial features and their personality. So, in my opinion, and what I try to achieve is that a good rhinoplasty blends structure and function with an artistic eye so that the nose looks normal, balanced, and it looks like it fits that patient's face.
Very interesting and a lovely, lovely answer there, Mr. Advani. And I think patients who are, yeah, you've really outlined the various reasons why people, go under rhinoplasty for various reasons, cosmetic reasons, or scientific, a more scientific approach. So thank you very much. And then some misconceptions then about rhinoplasty. Do patients often understand what a rhinoplasty is when they come in for a consultation, or do they have some misconceptions about the surgery?
Yeah, so it depends. Usually for functional patients, they may come in because of nasal blockage, and they don't know they require a rhinoplasty or septorhinoplasty to improve their nasal obstruction. Um, so, so they have a slightly different idea because they've not researched the operation before. However, patients who are coming specifically for a cosmetic rhinoplasty, or often patients who lie in between, who have a external deformity of their nose and nasal blockage, have done research into the matter, and so they they are quite well educated, and they know all about it.
So we have all seen the overdone look, especially on social media with rhinoplasty results. So what are some of the most common misconceptions regarding rhinoplasty results and this overdone kind of look?
Yeah, so that's a concern for a lot of patients. And in my opinion, the overdone look comes from chasing trends rather than thinking about what's right for balance of that individual patient. So the common misconception is that the nose should be a small, straight nose with a lifted up tip. And trying to achieve that can cause reduction of the overlying structures and weakness of the overlying structures, which makes the nose look unnatural. And also, by trying to fit that precise nose onto everyone's face, it gives an overdone look or unnatural result because it's not harmonizing with the other facial features of that patient. So, in my opinion, the best noses are customized to that patient's face, features, skin type, and profile. Um, the overdone look is something to be aware of and to speak to your surgeon about so that you have a good idea of what your expectations are and what the surgeon's expectations are.
Fantastic. A very, very good overview there, Mr. Advani, about it. Yes, this overdone look, so patients will really be clear about that. Fantastic. And then how is the rise? It's very similar then to question number three. How is the rise of social media and this selfie culture influence the demand for rhinoplasty?
Social media and selfie culture has definitely increased the demand for rhinoplasty and septal rhinoplasty. And I think this has to do with people seeing themselves in a wide angled camera on their phone. And this does tend to exaggerate proportions and make the nose look bigger. And this has made patients more self conscious. And needless to say, when people are comparing themselves to other people on social media, such as on Instagram, they are comparing themselves to some unrealistic images because there are a lot of edited images on Instagram. People are able to change the shape, the smoothness, the contour of their face, their nose, and their body. And so it's comparing apples with pears. It's a real person versus an unrealistic image. Having said that, the trend nowadays, from what I'm seeing in my practice, is people are actually shifting to a more natural look. So they still want to look refined, they still want their nose to look refined, but they don't want it to look like a filter has been applied, if that makes any sense. They want a natural look
Mhm.
that looks normal for them, but not too overly perfect.
Absolutely, that makes perfect sense. And it's great to see the patients are wanting to preserve that natural look. So that's fantastic. And question number five then, Mr. Advani. What can patients expect, both physically and emotionally, during the recovery process after rhinoplasty?
So this is a really interesting question because the post-operative recovery from rhinoplasty is up and down, and there are good days and there are bad days. But like any operation, recovery takes some time, and you have to be prepared for it. So when I do see a patient, I do tell them in the consultation exactly what to expect immediately after surgery and for the months ahead. And essentially, what I tell them is that on a physical basis, after the operation, they're going to feel really uncomfortable. They're going to have a cast on the top of their nose or a splint. They're going to have some splints inside their nose, and they're going to have some stitches, which are dissolvable. Their face will be very swollen. They may have black eyes. But over the next week or so, that's all going to improve. So they need to have at least a week, if not two, off from work. They'll see me in 7 to 10 days' time post-operatively, where I will remove the splint or the cast that's on top of their nose. I'll remove the splints inside their nose, and they will feel immediately much better, and they can return to their normal activities. Now, the swelling of the face and the swelling of the nose goes down drastically over a couple of weeks, but it can take several months for all the swelling to completely go down, especially on the tip of the nose. With regards to the emotional journey, it is a bit of a roller coaster because patients are very invested in this operation because they've thought about it for a very long time and they've been scared about things going wrong and they don't know how they're going to look afterwards. So it is really an emotional roller coaster and there are ups and downs. But generally, what I tend to see is that initially, when the cast comes off or the splint comes off the nose, people look at the mirror immediately and they are very, very satisfied. But there is some swelling, so the nose still looks and feels a bit strange, and they are worried sometimes, oh my gosh, have I made a mistake? But eventually, as the swelling goes down on the nose, almost always they are very, very happy, and their confidence rises immediately. And in the post-operative pictures, because you have pictures before the operation and after, you can actually see their levels of joy and happiness and confidence improve with pictures. So yeah.
Fantastic. It's so good to see that patients overall, if they just bear with the process and have that patience, they know it's gonna be worthwhile to go through that journey, like you say, the ups and downs, but it will be a positive result. So that's great to hear. Okay, question number six then. What is the difference between an open and closed rhinoplasty, Mr. Advani?
So an open rhinoplasty and a closed rhinoplasty is basically the surgical technique used to do the procedure. An open rhinoplasty uses a small incision in the columella, which is sort of the middle bit of your nose, just under there. And it's a small, tiny incision, and you are able to elevate the skin of the nose and do the full operation. The closed rhinoplasty uses some incisions inside the nose, so there's no external incision. Having said that, the incision used for an open rhinoplasty is very tiny and it heals really, really well. So I don't think patients should be too concerned about scarring at the incision site. Almost always, I've actually never had a patient tell me that they're not happy about the scar. In my opinion, open rhinoplasty works in a way that allows the surgeon to see better and to make all the complex changes needed and to be more in control of the operation and the outcomes. Whereas a closed rhinoplasty, you have less access, so it should be used usually for less complex procedures. There are some surgeons globally who are experts at closed rhinoplasty and do everything via closed approach. However, the majority of rhinoplasty surgeons tend to use an open approach.
So our final question then would be, how are innovations such as 3D imaging, virtual simulations, or even AI changing the way rhinoplasty procedures are both planned and performed?
This is a really good question because AI is at the forefront of everybody's mind nowadays. And in the rhinoplasty world, these technologies are most used in the planning of surgery. So, for example, there's something called morphing software, whereby somebody can take a picture of their nose, or I can take a picture of somebody's nose, and you can adjust various things on their nose to see the different effects that you can produce on the nose in a rhinoplasty, and if the patient likes these results or not. So it's more used in the planning of the surgery. Now, the way I use it is I use it to describe to patients what we can potentially achieve. And what I'm really looking at is the patient's reactions when we make specific changes. So I know if I make a specific change, say it's not exactly to the millimeter as per the morphing technology, is this patient going to be happy with it if slightly overdone or slightly underdone? So it can help me to perform the surgery and give the patient the best result possible. So that's how I tend to use it, and patients often have done it themselves. They come in, they show you what they want, and you can use it to describe if this is a realistic outcome, if it's not a realistic outcome. Now, from AI can help with putting things into proportion. So you can ask AI to show me what's the best look for my nose, etc., etc. So AI is useful, but with all of these, the important thing is that as a surgeon, you should not commit to any unrealistic expectations. So even though I use these technologies, I tell them that this we'll do our best to achieve this, but things are not guaranteed, and we have to remember that this is artificial intelligence, and this is, things in life are not always exact.
Absolutely. That's a very good philosophy, Mr. Advani. And thank you so, so much. Really, thank you so much for your insight.